Good morning, guys. My name is Moises Ceballos, and I'm going to talk about the hip strength and core endurance in female adolescent runners with and without knee pain. So, in definition, we have that core stability refers to a person's ability to stabilize their core. Stability in this context should be considered as an ability to control the position and movement of the core. The central stability is a set of different structures such as muscles, bones, joints, tendons, and ligaments that have the function of maintaining the spinal column, stabilizing the lumbar and pelvic area, improving balance and coordination, and supporting both internal and external forces. So, the core stability have a muscle system. In primary, we have the transverse abdominal multifurus. In secondary, we have some muscle. For example, internal oblique, abdominal rectus, median fibers of the external oblique, and lateral fibers of the external oblique, and lumbar squares, psoas major, diaphragm, spinal erector, pelvic floor muscles, iliocostal lumbar portions, and iliocostal thoracic portion.
It's common to hear coaches advocating their athletes perform some type of core training to help improve performance and reduce injury risks. But what's the most effective way to increase core stability? First, let's understand the function of the core in athletic movements. Consider a volleyball player spiking a volleyball. First, she must produce force through the ground to jump by loading her lower body musculature. This force is then transferred through her core overhead as she executes the spiking movement. When an athlete is lacking core stability, there's a greater chance of an energy leak and therefore a less powerful spike. So how do we train this core stability? Although some studies have shown a greater core activation in isolated movements, research tells us that increased activation does not lead to an increased force production and transfer. This means isolated core exercises or training on unstable surfaces does not teach the body how to transfer force. Instead, there is sufficient evidence that multi-joint strength training modalities such as a back squat or a hang clean helps develop the core stability needed to improve efficient force transfer and absorption mechanics. This means strength training and not isolated core movements are an imperative part of enhancing core stability, leading to an increase in performance and decreased risk of injury in the female athlete population.
Okay. In application in physical therapy, we have the importance of muscle balance. We have the Sherrington lay. The first lay, when a muscle receives a maximum stretch, it will suffer as a reflex effect and intense approximation of its edge, causing a maximum contraction. In second lay, when an agonist muscle of the movement it is executing contracts by inverse and successive innervation. We have some tests. The field test to assess core stability, we have the muscle condition test, for example, the test de Daniels. In second test, we have the body balance test and control test of the posture of the lumbar spine and pelvis.
If you're a runner whose knees drift together as you run, this video is for you. So, lots of the runners I meet are fully aware of their tendency for their knees to drift together into this knock-kneed, valgus position as we call it technically, and lots of these runners are running completely symptom-free. Others run with knee pain. The movement itself isn't necessarily predictive of knee pain, but it's often part of the bigger picture when it comes to the typical running knee injuries that we see, such as patellofemoral pain and ITB syndrome, just to name a couple. The position the knee moves into when standing on one leg is driven largely by control at the joint above and below the knee itself. So we're talking about the ankle below and the hip above. I described this in a little bit more detail a few weeks ago in episode number 23. I'll put the link in the description so you can go and check that out. Now, an important factor in helping your body better control the knee as you work into load-bearing flexion is to work on femoral control at the hip. In the case of so many runners, we need to get muscles like glute max and med working that little bit harder. And one of the exercises we use to improve the control of the knee when loading on one leg is a partial range single leg squat off the side of a step. The addition of a resistance band between the knees, similar to how we used the band in episode 23, works really well to help better engage those all-important stabilising muscles around the hip. Working to gently pull the band apart as you mini squat up and down gives your body the physical cue to work on the standing leg to counter the action of the band, pulling your knee towards that knock knee position we're trying to avoid. So grab yourself a resistance band, give this a go, and it's important that you only work through the range of motion that you can control. Stability trumps depth when it comes to single leg squats. Try working to 3 sets of 15, 4 or 5 times per week. As when it comes to training your body to improve stability, we're training movement patterns, which is different to training absolute strength. In this context, your body responds far better to the little and often approach rather than smashing it only a few times a week.
Okay. Pros and cons. The core functions in pros have stability, force transfer, and movement. And cons is late results. Issued applied in Ecuador. The scope of study for this research work was carried out with people between 23 and 46 years of age who have a diagnosis of scoliosis, cervicalgia, core muscle imbalance, hamstring shortening. The study population was 72 people between 23 and 46 years old who present musculoskeletal problems, especially of the spine in the EQ 911 study. A study in Ecuador, a decrease in pain in the spine was obtained, specifically in the lower back. Signs. At first, they had excruciating pain in the two genders of 47 and 29%. After having carried out the intervention, they did not present pain. 18 that 64%, and an increase in the strength of the spinal extensor muscles. And in conclusions, core training is a musculoskeletal complex that provides stability to the body. Core training must be global, in which all muscle groups are activated. Core training is an important factor in the athlete's preparation, and core training should be direct according the athlete's need. So,
to avoid knee problems, that's where the cross training and strength training is important. A knee is always to do with the tracking of the knee, usually a tight ITB and weak inside muscles, the knee stabilizing muscle. So you basically just want to strengthen your stabilizing muscles on the inside of the knee, keep the outside, the ITB nice and loose. Also, it comes a lot from the hips, so stretching well through the hips, piriformis, butt, hamstring. That all helps with keeping the knee and the knee joint in place. So I'm big on Stairmaster, elliptical, and the actually swimming as well, which really stretches your through your stomach and keeps your spine nice and straight and builds your lower abs. Cycling's good, spinning class is okay, but quite often if you've been sitting in an office all day, 10, 12 hours a day, and you're getting back on the bike and sitting again, it's just going to make you a lot tighter through the hips I mean, running, you've got to basically get everything forward. You've got to get this up, your hips forward, chest out, and so it's quite often tightness comes from your lower back, goes through your piriformis and down your ITB, gets your knee, pulls the tracking out, and that's how you end up with knee problems. So I would probably maybe have 1 day off in the program, and I would run 3 to 4 days a week, and the other days would be cross training and strength training.
So, thank you so much for your attention.